like I said earlier, that's why it takes anywhere between 3 to 6 weeks for the whole process to complete and have a final version of the value set that can be used within the workflow.
Yes, you can definitely see how depending on manual spreadsheets is going to slow that process down. Now, Wendy, are there technical considerations that keep in mind when you're creating, updating, and deploying value sets in an EHR or another system?
Yeah, currently, one of the technical considerations that we have is we try to use concept-based, because concept-based offer a very wide package of doses within a particular concept, and maintenance is much easier versus using a particular other code sets where you're entering one by one by one by one. So we try to start with that. So that's one of the technical considerations that we consider. And then one of the other ones is how much we already have available to us in that particular clinical space, and if we can leverage any of those items or share any of that build, and then what the end use will be, and from the technical perspective to the clinical workflows.
Okay, now Wendy, maybe you can get us started on this. How are IMO and Cedars partnering today on value sets?
Well, today, like I mentioned before, we are using the oncology value sets in our oncology and other areas, and we have been for for a very long time. Now we're starting to move into some medication protocol using the value sets and some of the refill medication protocol build that we're doing. We're also partnering on working on some other areas within the clinical space where we currently have our very manual, laborious maintenance workflows, where we're going to try to convert those into the value set editor workflows that IMO is offering.